Dear students, just to a case lesion, rather swelling in the lip, and find out what is this. So look at that. See that? See in the upper lip, very well localized swelling. Maybe small, whether difficult to appreciate here, bluish discoloration. So what is you have to always look different entities we'll discuss. So this is probably the typical look is probably hemangioma of the upper lip, cavernous type. Now it is usually warmness will be there, sometimes bluish discoloration will be there on the surface, localized swelling, soft, smooth, soft consistency. Usually not tender, but if there is some amount of inflammation in the venous wall or thrombosis, it may be tender. And compressibility, that is a very typical feature of the hemangioma. Compressibility is when you press, swelling reduces in size, and when you release the pressure, it comes back to its original size on its own. That's important. Whereas reducibility is different. When you reduce, it goes back to the cavity or place where it has come. It will not come back to its original size at all. It will not come back. It will not come back. Whereas compressibility comes back to its original size. That part, second part is very, very important when you define compressibility. When you press, it get reduced in size, and it comes back to its original size when you release the pressure. So that's the typical part, typical component of compressibility. You should know the definition. Hemangioma and lymphatic malformations are the compressible structure. Vascular malformations otherwise are compressible structure. No other conditions are compressible. So if there is a swelling with the compressibility, only these few conditions only will come into your picture as a differential diagnosis. That is why this test is very, very crucial when you diagnose hemangioma or lymphatic malformation or vascular malformations. So I have told already what is compressibility, warmness. So sometimes if it in the very close to the bone, it may cause bone erosion. Multiple hemangioma can be there. It may be associated with different syndromes. So for that, please go through my SRB's manual of surgery and SRB's clinical methods in surgery. And so it can cause hemorrhage, it may cause DIC, it may cause thrombosis, it may cause infection, ulceration, bleeding, sepsis, erosion into the adjacent bone, and large hemangiomas increased high output may cause high output cardiac failure. Not a hemangioma like, not a small hemangioma like this, very large hemangioma. Remember, organ which internal organ which causes which has got hemangioma very commonly is as a asymptomatic one is liver. Commonest benign tumor in the liver is actually a hemangioma, and hemangioma is quite common in the liver. They're usually asymptomatic unless very large and bleeds and causes thrombosis, all those things. But large one can cause high output cardiac failures and the complications which you have to remember. So compressibility is a very, very crucial. Remember, Doppler B mode duplex scan should be done. It's important. Dynamic CT angiogram or digital subtraction angiogram (DSA) is done to assess the extent and feeding vessels and plan for treatment. So initial Doppler to have a gross idea. Eventual angiogram or DSA is very, very essential. Then sclerotherapy, laser, ligation of feeding vessel, and excision with the help of a reconstruction surgeon or plastic surgeon. That is exactly you will treat such a patient. Often it will bleed. You have the limbs, you may have to use a tourniquet and so on. So for detail, please go through my SRB's manual of surgery and SRB's clinical method surgery to have the very clear idea about hemangioma. It's a short note for you. Viva they will ask, neat MCQs may come, and short case may be kept in the exam. Hemangioma will come definitely kept as a short case exam, or oxy also may be kept. That's why it is very, very important. Common entity, remember. As common muscular malformation is hemangioma. Remember that point you have to remember always. So students, again I am requesting, please go through my website, that is, and subscribe YouTube channel which will give the daily lectures of brief 5 to 8 minutes, which will update your surgical knowledge with the case scenarios, mainly images, instruments, brief operative procedure, on table findings, and also live session once at regular intervals, which will give a case discussion for 1.5 hours with the senior faculties in the online platform. You can always participate and put your doubts in the chat box. You'll get a proper answer, and also you'll get a certificate for joining a live session. That is also very useful for you. So always look for the live sessions and join the live sessions whenever it is there. Usually once in a week or once in 2 definitely will be there. So again, request to subscribe my YouTube channel. Also have my SRB's manual of surgery and subclinical method surgery is more than sufficient to have idea of surgery, place, exam, neet, everything. So answer the MCQ. I'll get back to you. I'll acknowledge your answer. The port wine stain is A, B, C, D. Put the right answer in the comment box. I'll appreciate your answer and give the right answer. And a 25-year-old female present with sudden episodic blanching, pain and pallor of both hands in cold environment, which eventually form flushing and pain. What could be the most likely diagnosis? A, B, C, D. Find out the right answer. Put the right answer. I will appreciate your answer and get back to you. And I'll also give the answer later. And quotation of the day is, let your success do the talking. Not you don't keep telling what you are doing to everybody. It automatically should be understood to the audience or people by your work as such. That is exactly meaning of that. Is true also. So students, again I request you to join my YouTube channel, subscribe for day-to-day surgical, upgrading your surgical knowledge, and also have my SRB manual surgery and clinical method surgery. So students, please go through my SRB's manual of surgery. It gives detail about the all CBMA syllabus and covers both for MBBS and postgraduate also. But we got MCQ for each topic wise. General surgery, gastrointestinal surgery, urology, specialty basics, urology, neurosurgery, cardiothoracic, all those basics are covered. Instruments, adjuvant therapy, chemotherapy, briefly about anesthesia, specimens, briefly about anesthesia, briefly operative surgery, and current recent advances also. Everything covered with the quotations, with the illustrations, with the photos. Everything is covered. It's more than sufficient for undergraduate to go through this book, learn surgery, and face exam, place MCQs, everything for both UGs and postgraduate. Also go through my clinical methods in surgery with the video of how to examine in each topic. It gives a detailed examination method, but of course there is no management in this. It's a clinical book, and briefly in a tabular form, differential diagnosis, and good photos, and exactly how to examine and how to write case sheet of each different topics, ulcer, swelling, breast lump, and everything covered. Briefly orthopedic also. It also has got specimens, images, instruments, which can always be useful when you take Viva and Oxy and practical exam. So very, very useful, because we have all videos of how to examine a patient. It's very, very important in your practical exam of any medical graduate of any type. It will be very, very useful. So please go through it and have it. And my operative surgery, the 2-volume book, new edition has come, and it was extensive discussion about the methodology, technical principles, and steps of the different operative surgery, major to minor. Everything is covered with around 10,000 illustrations and photos. And my tissue atlas of tissue approximation, small 100 pages book with the video, how to do suturing in different situations properly with the video. It has shown very well, and can always go through that. And my DigiNow lectures through JP Publishers, around 220 hours, covers everything, A to Z topic, urology, specimens, instruments, clinical examination, videos, everything it is covered. Please, you can purchase for a year, so that you will have the clear idea. You can face the exam, have the clear idea, academic part, everything. Will have entire subject is covered, including clinical part. So please purchase and have a clear idea about subject and to face the. So students, I hope you have understood this lecture very well. Thank you so much.